It's important that we continue to focus resources on those that are vulnerable, even while we see overall across the country cases going down, hospitalizations going down, and most importantly, our mortality rate is going down all across America. Now we're going to continue to focus with our governors on making sure that we deploy testing to our long-term care facilities and to our nursing homes. We'll be speaking with all the nation's governors in just a short while today, Mr. President, to continue that effort, because we're going to put the interests of all of America first. But as we move into this next stage and through the summer, putting the coronavirus in the past each and every day, we're going to focus on ensuring that our seniors and all of those most vulnerable are protected.
Thank you, Mike, very much. Great job. Bill, please.
Thank you, Mr. President, for convening this session and for your commitment to protecting America's elder citizens. We have made combating fraud against elders one of the department's highest priorities. And that's partly because we've seen a skyrocketing of fraud against elders as we've seen the conjunction of a growing older population coupled with new technology, particularly the internet, which has given fraudsters new opportunities for their schemes. And it's a priority also because the elder population are particularly vulnerable, because if they lose their savings, they don't have much time to regain their footing. So it's frequently a permanent loss for them. And so we have appointed a senior department official to be a full-time coordinator across the entire department. This has been going on for the last couple of years. And we have in every single one of our 93 U.S. attorneys' offices a coordinator focused exclusively on rooting out fraud against elders. Senior citizens lose billions of dollars each year. It's averages for an individual $34,000 when they fall victim to a fraudulent scheme. And we have found that many of the perpetrators, and in fact frequently the brains behind these schemes, are actually outside the United States and part of transnational criminal organizations. There are three things I'd like to highlight today. The first is this month marks the one-year anniversary of our transnational elder fraud strike force. When we started seeing the signs of the international organizations involved in this, we decided we had to run up the chain and try to go to the source of this fraud, as well as combating it at the local level. And we set up this group to do that. And over the past year, we've made a lot of progress in dismantling the infrastructure of these organizations, much of it involving the use of fraudulent robocalling. In January, we brought landmark civil actions to shut down some of the largest carriers of fraudulent robocalls. In fact, we were able to shut down 2 of the 5 entities that are responsible for the robocalls in the United States. Just one of these, to give you an example of the scale of these companies, carried 720 million calls during a 23-day period, reaching every state in the union. After these cases, we saw a sharp decline in robocalls to consumers. So stopping this wave of robocalls by going after these international organizations is a key part of our strategy, and we're also gaining some success. At the same time, we've cracked down on the network of financial operatives that are frequently called money mules, who take money from seniors and send it back to their bosses overseas. The Postal Service has been instrumental in this success, and Chief Postal Inspector Gary Barksdale is here to describe its efforts in more detail. But we're proud of all the strike force has accomplished in the first year, but we are, in a sense, just getting started. Second, I've asked the FBI and every U.S. Attorney's Office in the United States to prioritize elder fraud cases. And each year, for the past 3 years, we've had a sweep across the nation targeting these fraudsters. This year, we indicted 400 fraudsters for causing over $1 billion in losses to elders. And we're not letting up. We know that the fraudsters have gained new opportunities with COVID-19, and so we have also bearing down on COVID-19 fraud schemes. The third thing is, as the President mentioned, that we've set up a dedicated elder fraud hotline. It's like a 911 call for elder fraud. It's staffed 7 days a week, and we help the victims when they call get the resources they need to deal with the fraud. One of the things we found is that frequently our senior citizens are afraid to report or hesitant to report fraud because they feel that they have failed and they're embarrassed that they were taken advantage of. So everything we can do to encourage them to report is very important in getting after these criminals. And finally, as the President mentioned, we are making grants to the National White Collar Crime Center, which will enable that group to work with local police departments, local law enforcement, to develop training and tools to combat elder fraud. So this is the day-to-day work that's being done at the local level. I was once used as a lure shortly before the President appointed me as Attorney General. My official government image from the last time I was Attorney General was being used to attract elders to a website. If they sent money in, then I would help them get grants. And I'd get these very pathetic calls into my office of people who had lost everything. And they said, I feel so stupid. We've lost everything. And they just didn't know how to call. And, I called the sheriff, and he wasn't sure what to do. These are frequently people living in rural areas. And so at the local level, it's important to train local law enforcement as to how to respond to these kinds of sophisticated frauds that are coming in from these foreign organizations. So with that, Mr. President, once again, thanks for convening this session and all you do to keep America's seniors safe.
Thank you, Bill. Great job. Appreciate it. Hey, Gary, go ahead. Please.
Thank you, Mr. President. Vice President Pence, it's a pleasure to be here today to speak about some of the work that we're doing at the Postal Inspection Service to address transnational elder fraud. Protecting our elders and our veterans is one of the highest priorities of our mail fraud program, especially now as we start to see fraudsters take advantage of the coronavirus theme to incorporate that into some of their schemes. As Attorney General Barr mentioned, one of our key strategies is to attack the money mules. As he said, the money mules is really how the fraudsters get the money from the U.S. to their overseas accounts. Victims typically send money through the mail or other assignment carriers like FedEx or UPS. Sometimes they ask the victims to wire transfer the money, and oftentimes we see them asking them to buy gift cards and send it to the money mules. The money mules in turn then send the money overseas. So we see the money mules as a crucial link to disrupt if we want to be effective in this type of fraud. We've had some significant enforcement efforts. We also have some prevention efforts and some private sector engagement. One of our primary strategies, the center of our primary strategies, we're partnering with the Department of Justice, as Attorney General Barr mentioned, the Transnational Elder Fraud Strike Force. We've embedded postal inspectors at the department to work hand-in-hand with trial attorneys to bring some of these cases to justice. We have 17 field divisions who I've asked to collaborate with the 93 U.S. Attorney's offices and their elder justice coordinators on elder fraud investigations. And we've conducted significant enforcement efforts this past year dealing with the money mules. Just some of the stats, we've initiated this year over 100 investigations. These cases are associated with nearly $450 million in victim losses. We've also served over 2,000 unlicensed money transmitter warning letters to suspects, and working with the Department of Justice issued 34 civil injunctions. 17 arrests on those cases. We've also seized over $650,000. Also, as the Attorney General mentioned, the annual Money Mule initiative that we work in coordination with the FBI, HSI, Secret Service, and other financial partners. In addition to the 400 indictments he mentioned, law enforcement halted the conduct of more than 600 money mules. So in cases where we didn't arrest, we served on letters or put them on notice to stop the bad action. Another example of recent success, in November this past year, Jamaican national was sentenced to over 4 years in federal prison in order to pay over $500,000 in restitution to elderly lottery scam victims. We're also holding accountable the money service providers for their role in helping send fraud victims funds overseas. Companies like Western Union and MoneyGram, working with the Department of Justice, we've received, had actions for settlements well over $100 million. Our goal here, Mr. President, is really to try to get some of the money back to the victims. Since March of 2020, working with DOJ and our other federal partners, we've returned over $150 million to victims, which was over 109 fraud victims. Prevention is a big part of our strategy. Obviously, we'd rather educate, prevent a crime before actually the crime occurs. So we've put a lot of resources to come up with a platform. You go to our website, we have printed material, and we're starting to utilize social media, working with the Department of Justice. And I've just mentioned briefly, the last thing I'll just mention, Mr. President, it's also we're engaging the large banks to update their practices and to do their part in preventing the elder fraud. I'd like to thank you for providing awareness and making this one of the priorities of the administration. Thank you.
Thank you very much. Appreciate it. Thank you. Robert, please.
Yes, sir. Thank you, Mr. President. This is an important meeting for us at VA, but it comes on the heels of almost 2 years of constant reform that we've had at the department. We serve a unique population that has performed unique services to America, and I'm happy to report to the President that our approval ratings at VA are almost 40 points higher than they were in 2014 and 2016. As a result of that,
Can you give that number, everybody?
we have seen
That's a big difference.
it's at 90.1%.
Yep.
We have seen millions of Americans flock to VA. Last year, we set a record for the number of internal appointments at VA, 59.9 million. That is an all-time high. The reason that is important is that so many veterans have entrusted us with their lives and also with the well-being of their families. We have 134 nursing homes in the Department of Veterans Affairs, 7,500 patients. Over half of those come from World War II and Korea. We have, as we speak, only 4 of those 7,500 who have tested positive for the COVID virus. One of the reasons those numbers are so low is that a decision that the President made when we discussed what to do that first week of March. We had to make a drastic decision to cut off these deserving veterans, primarily from Korea and World War II, for the sustenance of their families in order to protect them. We tested them. We tested our employees, and we were able to cut them off from the most baleful effects of this virus. But in addition to those preventive measures, we were able to produce for the entire country on March 17th guidance on how to protect America's most vulnerable citizens. But that's only part of what the President has entrusted us with doing. I am the son of a grievously wounded combat soldier from Vietnam. The President gave me instructions to make sure that the last of the circles left over from that conflict were closed. And this fall, we will finally start providing sustenance, financial and material, to the families of those veterans from Vietnam who care for those veterans. So all of the mistakes made 50, 40 years ago, we will finally rectify. And the last thing I will say is that VA has reached a milestone, not only in terms of trust, but also in providing the country with assistance in terms of helping our most vulnerable citizens. As we speak, we are in 48 states right now, in hundreds of nursing homes, providing nurses, gerontologists. We've taken over the management of several state veterans' homes in order to protect our most vulnerable veterans. And we've done it with our employees who have gone in harm's way without any question when it comes to their own safety, helping the most deserving of Americans. And to finally say our numbers, we serve 9.5 million veterans in VA. We have 14,000 veterans who have come down with the virus. But of those 14,000, 12,000, almost 12,000 are fully recovered. And in our nursing homes, again, of the 7,500, only 4 have tested positive for the virus. I cannot thank the President for his support. I cannot thank our employees at VA for their heroic action. We are on the front lines when it comes to bolstering the lives of the most deserving Americans, those who have carried our freedom on their shoulders. So, Mr. President, I thank you for everything you've done for America's veterans.
Thank you very much. Appreciate it. Alex, please.
Well, Mr. President, thank you for what you've done throughout your administration to protect older Americans and to help them live longer, healthier, more active lives. Before the COVID-19 pandemic struck, your administration had already put a major focus on keeping our older Americans healthy and safe, and that focus has continued during the current pandemic. During this crisis, thanks to new funding secured by the President, HHS's Administration for Community Living has pushed out more than $1 billion for services for our older Americans that they need to stay comfortably in their homes. That's more than a 50% boost in the annual support that we provide for community organizations that provide services like delivered meals, help with trips to the grocery store, to the doctor, and assistance with chores at home. We're also making it a top priority to protect older Americans from a public health perspective. We've required states to put a significant focus on older Americans and nursing homes in all of their COVID-19 work, especially the state testing plans that they've now submitted, and we're working very closely with the states to make sure that that's the case. We've deployed CDC experts and members of the Public Health Service Commission Corps to prevent and respond to outbreaks in our nursing homes. We also know that isolation due to extended stay-at-home orders can make some older Americans more susceptible to the types of abuse, neglect, and financial exploitation that we're talking about today. This past week, I addressed that topic as part of a meeting of the Elder Justice Coordinating Council, which I chair as HHS Secretary. Last week, we added the Department of Homeland Security to the EJCC as the 15th member agency, reflecting the President's commitment to protecting our seniors from abuse. In 2018, we made a focused effort to expand the work of the EJCC and dedicate funding to prevent and combat abuse of our older Americans that results from our country's opioid crisis. Through the work of agencies across the Trump administration, we've made great progress in strengthening and improving our federal response to older American maltreatment in recent years. Under President Trump in 2018, all 50 states began participating for the first time in the National Adult Maltreatment Reporting System, which produces data that's been widely acknowledged as necessary to drive action and implement reforms. In March, when the Justice Department announced its National Nursing Home Initiative, Attorney General Barr was joined by our Assistant Secretary for Aging, Lance Robertson. We haven't pulled back on our efforts to protect older Americans during the COVID-19 crisis, despite the additional challenges. For instance, we support state long-term care ombudsmen who help older Americans who encounter issues in nursing homes and assisted living facilities, resolving more than 138,000 issues just last year. During the pandemic, ombudsmen have been adding virtual walkthroughs, where nursing home staff walk through the room to room throughout the facility with a tablet and allow residents the opportunity to meet virtually with their ombudsman. Finally, I want to emphasize the overall success we've seen with increased access and lower costs for older Americans who need prescription drugs. According to data from the Labor Department's Bureau of Labor Statistics, prescription drug price inflation has essentially been flat since President Trump announced his drug pricing blueprint from June 2018 to April 2020, after averaging 4% growth per year for the previous 5 years. That's a tribute to efforts across the administration, including record-breaking generic drug approvals in each of the last 3 years at FDA. Lower prescription drug costs, more support for older Americans in the community, better protection in nursing homes and assisted living facilities. All of these steps mean more healthy, prosperous years for older Americans to spend with their loved ones. And that's what President Trump has promised older Americans, and that's what he's delivered. Thank you, Mr. President.
Thank you, Alex, very much. Good job. Ben?
All right. Well, thank you, Mr. President, for all the work you've been doing to get our country back on track. And, America owes a lot to our seniors. They're the ones who really built this country up. They're the ones who've made this nation a destination for people from around the world. and they're wonderful fountains of knowledge that live among us. And I'm proud to be a part of an administration that really values our elderly citizens. You know, Mr. President, you promised not to forget the forgotten men and women of our nation, to put special emphasis on them, and that's been the case with a lot of the elderly over the course of time. And at HUD, our Housing Choice Voucher Program provides rental subsidies for 4.7 million families, low-income families, including elderly and disabled, who make up more than 50% of the voucher holders. The CARES Act has provided an additional $3 billion for this program so that we can assure any senior who needs help that they will receive assistance. Our Section 202 program, another area that prioritizes the elderly in housing, providing low-income elders with options which allow them to continue to live independently. And supportive services such as cooking and cleaning, transportation, all of these things we're making sure to provide quality of life for these individuals. CARES Act provided $50 million in additional funding for this program to cover a lot of the expenses that were unforeseen before the COVID-19 crisis hit us. Some of HUD's other programs include Home Equity Conversion Mortgage Program, which over the last 3 years has undergone substantial improvements, particularly under the guidance of our now Deputy Secretary Bryant Montgomery. And this really allows seniors to age in place and utilize the equity that they've accumulated over the years. And since its inception, FHA has insured more than 1 million reverse mortgages. Our public housing authorities assist our low-income Americans, including seniors, in finding quality, affordable housing. And HUD also has a portfolio of hospitals that we insure that obviously provide significant services to seniors across the country. Those are just a few of the efforts that we have taken to help those who've given so much over the years to this nation. As a compassionate society, we have an obligation to take care of the most vulnerable citizens. And they're also very valuable citizens. Without them, this nation would not be where it is today. And I'm proud to work alongside you, Mr. President, and the others sitting here and this whole administration, which really does value our senior citizens. And we're grateful for the wisdom that our seniors share with us every day.
Thank you very much. Excellent. Seema, please.
Well, from day one, the President has made his commitment to the Medicare program absolutely clear. And like few presidents before him, he's always understood the pressing need to modernize the program and also make it more affordable for seniors. He just talked about how premiums are lower in the Medicare Advantage program. We're at a 13-year low. And in the Part D program, which is prescription drug coverage, that's at a 7-year low, which is absolutely historic. We're putting dollars back in the pockets of our seniors. Also talked about not only the fact that we're lowering prices, but we're actually adding more benefits to our Medicare Advantage plans. We changed the regulations to give our plans more flexibility to provide services that will keep seniors in their homes and more independent and healthy. So that could be something like just putting a handlebar in their home to help them get up the stairs. It could be meal services after surgery. It could be pest eradication services, but giving our seniors more services at a lower cost. You also heard the President talk about the insulin program, $35 for insulin going forward. I had an opportunity to travel with the Vice President last week, and we ran into a gentleman at Dave's Diner in Pennsylvania. And he came up to us, he showed us his insulin, and he said, you know, I need this for my survival. And because of the President's leadership, he said, I'm going to save $5,000 a year. So he was really excited, and I think that shows how much the President has delivered to our seniors. But our work also goes beyond just the Medicare program, and we are working to ensure that our seniors are safe in nursing homes because of the President's early action with nursing homes in terms of restricting visitors and also making sure that our nursing homes were supported with recommendations around infection control. 80% of our nursing homes across the country have actually done pretty well. They haven't seen any cases of coronavirus or any deaths. That being said, we are focused on the 20% of nursing homes. We've been working with governors, asking them to test nursing home residents and their staff, and to do that routinely so we can ensure that our nursing home residents are safe. And we're encouraging governors to go out to these nursing homes and perform inspections, boots on the ground, so that we can ensure that those nursing homes are taking the proper precautions. And then finally, the President has also convened a commission on coronavirus for nursing homes to ensure that we are delivering quality and safety to our nursing home residents. So thank you, Mr. President, for your leadership.
Thank you very much. Thank you. Great job. Kellyanne, please.
Thank you, Mr. President, Mr. Vice President. Mr. President, we heard you many times 4 or 5 years ago saying that if we don't take care of our veterans, if we don't take care of our seniors, who are we as a nation? And you promised then and have delivered now many times to protect their entitlements, to preserve and to protect Social Security and Medicare. But our seniors are also entitled to dignity, to safety, to the presence of mind and the peace of mind of knowing that their financial assets are protected from money mules and from those who would lure and lurk among them. All of the great work that's been done in trying to solve this global pandemic, including for our seniors, has also left them vulnerable in a different way. They're away from family members. Many of them are in their homes, taking advantage of the great work that our health and economic teams have been doing for them and our justice teams. But they also are bigger, brighter prey for many of these predators. And so we want to make sure that the physical abuse we saw in videotape a couple of weeks ago, a person or persons being abused in a nursing home by an errant individual, criminal individual, that we all know that, we shine a light on that, but also these financial crimes are very serious. So thank you for all you're doing in that regard. Since so much has been said by the august members around the table, I'll end with this. It's really a message for the media. I know many of you don't like being told that you are guilty of biased coverage, but don't be guilty of incomplete coverage. Today is World Elder Abuse Awareness Day. There is a board behind me and one over there. You choose every single day, every single moment, what message to tweet, what news to report, what story to tell. Please include this in your reporting. It is important. It is World Elder Abuse Awareness Day for a reason, and you can help us with that awareness. Be a resource, be a friend to America's seniors today, if not seniors internationally, by letting them know there are tools at their disposal, and we are here to help solve these problems. Thank you.
Thank you very much. Good job. So we're taking care of our senior citizens better than ever before. There's never been this much effort. There's never been this much money spent. We're taking good care of them, and thank you all very much. Thank you.